Sunshine, it's our sunshine.
Hello everyone, I am Dr. Vidyasagar Chandankere, Paediatric Orthopaedic Surgeon at Sunshine Hospitals. So today I am going to discuss with you some things regarding knee deformities in children, especially below 7 years age. Most of the parents are bothered that their children have bow legs, and later on also they complain that the children have knock knees. So that is the commonest complaint which I see for the parents who come to my OPD. So I'll discuss something about these cases and when it should be referred or when it should be shown to a physician, and till what age it could be normal and what are the red flags to see for. So up till 2 to 3 years, bow legs are very common, and it is physiological because it does not lead to any permanent disability. So once the child reaches 3 years, the leg length and the alignment is almost neutral, and then after 3 years the legs go for valgus and what we commonly call as a knock knees. So knock knee is very common after 3 to about 6 or 7 years age, but slowly the knock knees correct themselves by around 7 and 8 years, and this is the time when this developmental period when a lot of changes happen, and from bow legs they go to neutral, and from neutral they go to knock knees. So this is a regular pattern noted in all the children. So there is nothing to be worried if this falls into the same age group. So only when the parent should be bothered and bring to a physician or to their pediatrician for checkup is, let's say they have a unilateral problem, one-sided problem. It could be right, it could be left. If they have a one-sided bow legs or knock knees, it's worth a referral and visit to your pediatrician or physician. The other sign would be if it is a progressive deformity. Let's say over a period of 6 months to 1 year, you notice there is no change, or despite giving some time conservative treatment, it's progressing. Either it's knock knees or bow knees or knock knees, anything. If it's progressing, then it is worrisome. So that is second flag sign. So the other thing is if there is a change in gait pattern which is quite significant because of this deformity, and sometimes they could be having a waddling gait, and at other times it is too much gross, and the usual complaint is they have frequent falls, and both the knees touch each other and they are not able to run for long distance or something. So these are the common complaints. So when you notice anything unilateral, anything which is progressive, and anything which is bothering in walking or day-to-day activity, it should be noticed, and you should seek a referral. And coming to treatment part, see, there are various causes for knock knees or bow legs in this age group. The commonest ones I'll discuss with you: rickets, and it's mostly nutritional, and sometimes it's renal as well as familial. So the nutritional rickets can be corrected with supplementation of vitamin D and calcium, and then gradually as the bone density improves, bone heals faster, the deformities in younger child remodels completely without the need for surgical intervention. For those patients who are not diagnosed with rickets and who have bow legs, one more problem which we call as a Blount's disease that could be present, and sometimes it's also bilateral, and in such cases initially in the early stages it can be managed in less than, let's say, 1.5 or 2 years or 3 years kid, it can be managed with splinting. But after that, if the patient or child is noticed with a Blount's disease, there is a likelihood that they might end up with some kind of surgery, and surgery is also straightforward. It corrects the deformity, and sometimes we need to do growth modulation, stop the growth on one side and let the other side growth take over, and that leads to spontaneous correction. And in older age, in Blount's disease, usually the prognosis may not be so good because permanent physeal bar develops, whereas in younger and early stages it can be managed with good results. We discussed about rickets, we discussed about Blount's, and something I'll discuss about knock knees here. So if a child is having a persistent knock knee and having difficulty in running, or it's unilateral, then that may need intervention after the age of 7 years. So some children develop one-sided knock knee after fracture of the leg, that is just below the knee. Any fracture below the knee sustained just below the knee can lead to unilateral knock knee, and usually it remodels in 90% of cases, and over a period of time you may notice some progression, but ultimately it corrects itself. If it doesn't correct even after 3 to 4 years, maybe that time it might need some corrective osteotomy. So the other cases which we call as idiopathic, there is no reason why they have developed. So in such cases, in the growing child, a child who has more than 2 years of growth remaining, they can be treated and easily managed with growth modulation, and we use small clips which we also call as 8 plates, and these are put on the side of the knee which is supposed to be arrested, or which is supposed to be arrested temporarily, so that the other side, either it could be left or right, takes over and the deformity correction happens. In the younger kids with nutritional rickets, splinting can be attempted, but usually it fails in the older kids because the bone is not so soft to bring about any changes with splinting. So I think any patient more than 8 years will probably land up with the surgical procedure, and these are very minimally invasive, and the patient can be up and right and walk immediately after the surgery and even next day. So once the growth is completed, then it becomes a challenge because there is no way the growth plates are going to help us into getting the correction. So in those cases we need to do a osteotomy, or we cut the bone at a level which is near the knee, and then we set it right, and then we fix it with plate, or most of the times we fix it with plate, and then after 1.5 months to 2 months the patient can start weight bearing, and gentle knee range of motions are started immediately, and it should give good result.
Sunshine, it's our sunshine.